Good afternoon, faculty. It's Chris Schaefer with a faculty development video, this one on milestone evaluations. So first, what are the milestones? The milestones are what you've been seeing in your resident evaluations for the past few months, and they are the new language that the ACGME wants us to use in describing a resident's progression through training. The milestones come for the usual 6 categories of resident behavior that we've known and loved from previous evaluations: patient care, medical knowledge, practice-based learning. That is, are you able to change your behavior based on feedback? Professionalism, communication, systems-based practice. Do you understand how to utilize all the resources in your healthcare system? Milestone evaluations range in score from 0 to 5 and are supposed to reflect a resident's progress through their training. So I'm going to talk now a little bit about usual scores. Keep in mind that an exceptional resident may score higher and a not so great resident may score lower than their usual score. So first of all, the score of 0. 0 is also known as critical deficiency and would be considered a failing score in an area. Good to know if you feel like a resident really has a so-called critical deficiency, 0 is the appropriate score. Now, how about the score between 1 and 2? What does this really mean? Scores between 1 and 2 are best summarized as inconsistent. Inconsistent patient care, inconsistent medical knowledge, inconsistent professionalism. These are scores, these are best reflected as a score between 1 and 2. This would be a usual score for a starting PGY1. Scores between 2 and 3. I like to think of these scores as residents who are displaying consistent behavior, consistent medical knowledge, consistent communication, consistent patient care. That's a score between 2 and 3 and is where we expect a usual PGY2 to be. Scores between 3 and 4. These are scores of someone who is ready to practice independently and is obviously consistent with their medical knowledge and their systems-based practice and has shown the degree of competency to practice without supervision. And finally, scores between 4 and 5. These are scores for the superstars. These are the residents who are excelling even in training, and every once in a while we see someone who we think they picked up a physical finding or a piece of history that I didn't get as an attending. That's really an excellent performance. That's a score between 4 and 5. Note, a PGY1 could be getting scores between 4 and 5, but that would be unusual. And we're hoping that as the residents progress, by the time they're at PGY3, they're all scoring in the 3 to 4, some into the 5 range. So this has been a short introduction to milestone scoring from Dr. Schaefer. Thanks very much. We'll have some more videos on the way in the coming weeks.